Hi, everybody, and welcome to another edition of our Taking Control of Your Diabetes podcast. I am one of your hosts, Dr. Jeremy Pettis, and I'm joined, as always, by
Dr. Steve Edelman.
And we have two very special guests today, two more endocrinologists with us. First is Dr. Tricia Santos.
Hi, guys. Thanks for having me.
And Dr. Schaefer Bader.
Hi.
And both Trish and Schaefer are also endocrinologists with us at the University of California, San Diego. See patients with diabetes, actually specialize in diabetes.
Star faculty of our TCOID team.
So we have four, all-star diabetes specialists here to talk about tips for people with type 2 diabetes. We just did one on type 1, so this is going to be the kind of type 2 version. And the idea here is things that we're commonly hearing, kind of like broad categories of actual tips that we give people in these important areas. And we're going to go through these in no particular order, but we decided that important areas would be talking about weight management, talking about new medications or medications in general, talking about technology for type 2 diabetes, continuous glucose monitors, potentially insulin pumps, and then an important category of kind of the psychology around diabetes, what we call diabetes burnout. Just how do you kind of live well mentally with this chronic condition, the medications, the highs and lows, literally. So that's what we're going to go through. So let's start with weight management. And what that typically means is for people trying to lose weight, which is difficult for everybody. So I'll just throw it out there. Who wants to start first with a tip that they might have for people living with type 2 diabetes and want to work on their weight?
I have a short one.
Okay.
Basically, my thing with people with type 2 diabetes, that you get it later in life. You're already stuck in your lifestyle habits. You got your cultural and ethnic preferences, and you can't just change your diet by seeing a dietitian fresh out of school. I say eat the food you like in moderation and just pay attention to your portion size. And that way, that's what you want to do. You want to cut what you normally like to eat to a point where you can maintain your weight or even lose a little bit of weight.
I've heard you say that before. It's not what you eat, it's how much you eat.
That's right.
Which really is what it is. So, okay. I like that tip. Trish, anything to add or a new tip?
Yeah, mine's kind of along the same lines. The tip I always give people is to set achievable goals that are like the smallest goals. So something that you cannot fail at. Like my goal for exercising today is walking to the mailbox. Because sometimes people set these goals like I'm going to exercise 30 minutes a day and 7 days a week, and it's just not possible. And then you start setting yourself up for feeling like a failure. So I think setting those small goals that you absolutely cannot fail at, like I'm going to eat 3 tortillas instead of 4, those types of things, I think make you feel good too.
Mm-hmm. All right. Schaefer, anything?
Yeah, those are actually great tips. So just to switch it up a little bit in terms of the direction, we're gonna I'm sure we'll talk about some of the newer medications and things. So I won't get into the details of those, but suffice to say that we have medications now that we use in diabetes that can help with weight loss. And some of the older medications are either weight neutral, so they kind of don't add or subtract weight, or some of them can even promote weight gain. And so basically the tip is just to take a look at what medications you're taking and add that into your thinking about diabetes medications. Is not just, what is it doing to my blood sugars, but what are they doing to my weight? And that doesn't mean if you're on some medications that can cause weight gain that you should just stop them, but it means have a discussion with your provider and bring up this as a question to them and think about, what might be some medications that would also work for diabetes drugs, but that can help your weight as well.
Yeah, and I guess my tip would, like, I heard Bill Polonsky, who's a psychologist, say this a long time ago, which I really like. And he would say it's easier to add something than to kind of take it away. So a lot of times people say, well, I'm just never going to eat ice cream again. I'm never going to eat chocolate. I'm just never going to have another drink. Versus I'm going to start, walking to the mailbox today or walking around the block or whatever, just adding something proactive that you can be happy about rather than I'm going to kind of punish or, deprive myself of something. So I kind of like that. But honestly, my main tip, which goes into our next category, as Schaefer's saying, the most effective thing we have for weight loss now is these new medications. Because let's be honest, that, you guys listening out there, if you've been, trying to lose weight, you've probably been trying to do it for years, if not decades. And the diets, you've tried all the different stuff, it's very hard to lose weight. And that's where these new medications are going to be so helpful, because they can control your blood sugars and help you, actually lose some weight. So this brings up our next category, new medications. And Steve, maybe do you want to talk, let's do them kind of maybe one category at a time. Do you want to talk about SGLT2s or GLP-1s? What do you want to talk about?
Sure. Well, I think if since we're talking about weight management, we should talk about the GLP-1 receptor agonist. Sorry about all these jumbled letters, but these are drugs like Trulicity and Ozempic. And these drugs have been out for many years. You take them once a week, and they not only improve your glucose levels, but they will also affect the way you eat your food. They induce satiety, which is the feeling of being full. And they all lead to reduced weight. And I think, they now have higher doses of Ozempic and Trulicity, which allow people to lose more weight. So these are the mainstay. In addition to that, we'll get into a little bit more, but they also seem to protect the heart against heart attacks and the brain against strokes. And then, of course, we have the blockbuster drug that maybe one of our other co-panelists can comment on.
So I'm thinking, let's stick with the GLP-1s for a second. You mentioned they're so important, and they're once a week, but they are injections that you take once a week, and they do have some side effects that can be mitigated. So Trish, maybe walk us through like a conversation you have when you're starting somebody on one of these medications. How much do you go through like what actually they do in terms of the effects on the body? How much do you talk about injections? How easy are they to get with like cost and insurance and all that? How do you have that conversation?
Sure. So in general, I usually talk about all the perks to these medications. I mean, Steve, you talked about them. I feel like these things should be in the water. They just are so good. They have so many benefits, the blood sugars, the weight, and, protecting the heart. So I always go through that, and usually patients are sold by that. And then I do talk about the adverse effects or the potential side effects. And mostly I focus on nausea because that's really the most common side effect that you can get with these medications. And I give my patients some tips with how to avoid the nausea. So that is going up slowly on the medicine, starting on the lower dose. We can actually go in between doses with some of these medicines, believe it or not. So that's kind of a tip. And then, one of the things that really helps with nausea that I tell my patients who are starting these medications, only about 30% of people will get nausea. But if you eat smaller, more frequent meals instead of kind of 2 giant meals per day, that really helps because these medicines work by leaving food in your stomach longer, making you feel full faster and longer. That's one of the ways that they help you lose weight. But of course, that can really make you nauseous if you have kind of a giant meal sitting there. So I do tell people to, think about eating smaller meals if they need to.
And Schaefer, what about this injection thing? When like the people have all kinds of conceptions about what an injection is.
Totally.
So
yeah. I mean, I think, unfortunately, a lot of that comes from, injections can be scary for people that aren't used to doing it. And that's understandable for sure. And I think also, unfortunately, people have this association with insulin as sort of like a scary thing to have to inject. And once you get used to insulin and you realize it's just a medication that we use as a tool, I think people tend to get over that. But if you're starting an injectable for the first time, it's scary in 2 ways. One, you're actually giving the injection. And 2, it's like, is this really, this is a huge escalation in my therapy? Like, do I need an injection? But really, ultimately, the reason that these medications are injectable is not because they're like super hardcore or scary. It's just that's the way that they're formulated. That's the best way to get them into the body. And it really allows them to be given once a week. And so ultimately, that to me, I see as a huge benefit. So, I mean, once you've tried one of these injections, they're very easy to give, and some of them come in an auto injection. So I always go through the process. I teach my patients how to give the injection. They're super easy to use. And they're not painful. So that's, once people have actually done them, they say, oh, that was nothing. That was easy. And you do that once a week and you kind of don't have to think about it the rest of the week. So in some ways it's easier than a pill that you take every day. It's a once a week injection. So I think that part, getting over that little hump tends to be, once you've actually done it once, it's actually really easy.
Let me just add that these GLP-1s, they mimic a natural hormone in the body, and the very first one was approved in 2005. So we know the safety profile very well. It's not guinea pig medicine at all. And so then there's several in the same class, and we have choices now.
So I think in this conversation about medications, it's helpful a little bit for us to walk through our listeners about our approach to general diabetes management when it comes to medications. And it's important to know, I'll say this real quick, that type 2 diabetes is a progressive disease. that over time, the cells in your pancreas, the beta cells that make insulin, can fail. And that means that over time, you will require more medications. So our normal treatment, quote unquote, algorithm is to actually add medications generally as time goes by, which may be very different than people are used to dealing with other diseases. You know, if one antibiotic doesn't work, you don't add another, you usually switch it. So people can have this conception, as you were saying, Schaefer, like, am I getting sicker? And it's just about using the medications to keep you in a healthy place and to try not to get so hung up about the number of medications. So to be specific, when people are diagnosed, we sometimes start with just diet and exercise, but we usually add metformin, quickly. It's our first agent that we use. It's an oral agent that's been around forever. It's well tolerated. It's efficacious. And then after that, the door really opens where we try to get people as much as possible on these two new classes of medications. One is the GLP-1 receptor agonist that we just kind of talked about, these injections. And the other is a class of medications called, get ready, SGLT2 inhibitors. And the way these drugs work is they basically just make you pee out sugar. And when you pee out sugar, your blood sugars come down. You can actually lose weight because you're losing calories. And now we have all these like new benefits of these medications, reducing heart disease, kidney disease. So Steve, maybe start us with, talking a little bit about these medications and do you use them in all your type 2s? Like, what's your recommendation? Like, I would go so far as to say that everybody with type 2 diabetes should be on an SGLT2 inhibitor and a GLP-1. And how do you feel about that?
You say SGLT2 so fast. Well, first of all, a tiny history note is that when these drugs first came out, everyone thought, it's going to cause damage to the kidneys, it's making the kidneys spill sugar. And it turns out, to make a long story short, they shocked people by showing that it reduces congestive heart failure, which is the most common cardiac abnormality in people with type 2 diabetes and does not carry a good prognosis once you've had one episode. Then they discovered that it prevents the progression of diabetic kidney disease. As you mentioned, it lowers glucose, it lowers blood pressure, and you can actually lose a little bit of weight on it. So and the side effect profile is extremely low. They're very well tolerated. So I happen to agree with you that it's probably one of the most important classes. It's one pill once a day in the morning, and you can take it with every other diabetic medication on our entire armamentarium. So I think when I look at the problems with heart disease, kidney disease in folks with type 2, it's a tremendous advance, and we have several on the market now. I'm sure Tricia or Schaefer, you can add to that.
Yeah, I think one of the important things I'll add, and I totally agree with you, Steve, is that the confusing thing about where we are with these medicines now is that, like Jeremy said, they're really for everyone. So you may be sitting here listening and saying, well, I'm on metformin and my A1C is 6.6 and I'm doing great. I don't need that medicine. But what we're here to tell you is that this medicine is so good. The SGLT2 and the GLP-1 are so good at weight loss, heart benefits, kidney benefits, that you should be on it even if your A1C is good, which is a whole new way of thinking for us in the diabetes world. Normally we were really A1C focused, and now we're thinking about all these other benefits that we could get.
Yeah, we should mention the name so you're familiar with the TV commercial. Jardiance and Farxiga are the two main ones. And even the American Diabetes Association, they give doctors recommendations on when and how to use these medications. And they said exactly what you mentioned, Tricia. It's irregardless of the A1C. Schaefer?
Yeah, I do. I have one comment, and it's really just, here we are talking about all these medications, and just a comment for the people out there, which I get, those people that are like, but I want to get off of medications. And I get, that's something that I hear all the time in the clinic is, well, okay, you're telling me about all these new medications, they're great benefits, but like my goal is to get off of medications. I think this, in some ways, that comes back to both what Trish and Jeremy said. When Jeremy was talking about, that the way that we think about these medications and we're adding them on stepwise to get benefits is because we're actually they do different things, and each of these medications are targeting a different part of diabetes, but also these other metabolic issues that are going on to help protect the kidneys and protect the heart. And so I think it's hard, but I think we have to get away from this concept that being on medications equals being sick. You could be on no medications and be terribly unhealthy, or you can be on a bunch of medications and be really healthy, partly because of those medications. And so these medications that we prescribe, we do so because they protect from heart attacks and they keep your kidneys healthy. And so they do all these great things, and adding a medication doesn't mean you're getting sicker. And being on 3 medications instead of 1 doesn't mean you're sicker. It may mean that you're healthier. And so being healthy is not counted by how many medications you're on. It's counted by if you're healthy or not.
Absolutely. And Steve especially has heard me say this a million times, that these drugs, the GLP-1s and SGLT2s, are not approved for people with type 1 diabetes like Steve and I am legitimately jealous. That's not a joke. I mean, these are just they do so many things, and I think it's a real opportunity for people to have, to be able to use these medications rather than, kind of, woe is me, I have to take it. And, when people say that, like, I want to get off medications, you have to stop and ask, like, well, why? And it generally comes down to this perception of their health. And it's reminding them that we're using this medication to kind of keep you healthy in the same way that we use vitamins or these other things that people deem okay to take because they're preserving their health. That's just kind of the same like approach we need to adopt with these pharmacological agents. So next big category is going to be diabetes technology, which we talk up and down and sideways in type 1 diabetes. But now we're talking about it, a lot more in type 2 diabetes, specifically with continuous glucose monitoring. So I'll start, maybe we'll go backwards this time. Schaefer, when we talk about CGM and type 2s, who is this really for people with type 2 diabetes? Everybody or just certain people?
Yeah. And this is really sort of a cutting edge topic, and our thinking about this is rapidly shifting as well, because even until right now, and if you ask your insurance provider, you may get the answer that CGM is only for people with type 2 who are on multiple daily injections of insulin. So that may be one answer, is that what's covered, right? It's covered for people who are on multiple insulin injections. And that is important. It's extremely important for that group of people. So if you take insulin, you're at higher risk for low blood sugars. And you also need this sort of continuous feedback of what's going on with your blood sugars to make insulin dosing decisions and all that. So for sure, that group of people, that's a no-brainer, even though it took a long time to convince folks of that even. But we're learning more and more that whether you're on insulin multiple times a day, maybe you're on once a day insulin and some other medications, or you're not on insulin at all, you're on other medications. And even in people who are on no medicines, maybe you have prediabetes and you're not on any medications, using a CGM can actually still improve your blood sugar by significant amounts. And it's because there's so much knowledge and education to be gained from seeing what your glucose blood sugar is doing throughout the day and getting real-time feedback on what you're eating, your exercise, how your medications affect your blood sugar, how things even like stress and sleep affect your blood sugar. And people I've seen just really, anecdotally, I've seen really amazing results on people who aren't necessarily on a bunch of insulin, but they put a CGM on, and all of a sudden it opens up this world of understanding what their own body's doing and really helps them to make healthy decisions.
Yeah. So I would say, I guess a specific tip there, I agree obviously with everything you said. If you have type 2 diabetes and you're on mealtime insulin, for God's sakes, get a continuous glucose monitor. You're eligible for it. Get in to see your provider, ask for it, and you'll do better. And thankfully, more and more people will get this covered with type 2. In the near future, it's going to be everybody. So Trish, I don't know, do you experience kind of resistance for people starting CGM or anything? I don't know, you want to talk about with CGM?
No, I would say there is quite a bit of resistance actually, which is shocking to us who think that this is the greatest thing since sliced bread.
Which is is that great? That saying's always never made that sense to me.
But like ice cream sundae or something.
Well, Dave's bread is pretty good.
Yeah.
I do like when my bread is sliced already.
Yeah, okay.
Anyway, patients are resistant. And the sense I get is that people don't want to see their blood sugars all the time because they know that maybe they aren't it's not what they want to see. And so the tip I give patients, I guess I would say, is that just because you can't see it doesn't mean it's not there. Right. So if you go eat an entire pizza and you don't look at your blood sugar, it doesn't mean it didn't go high. Right. So I try and tell them that knowledge is power, and that by being able to see what happens to your blood sugar, it truly changes behavior. So maybe, you'll see what happens when you walk around the block, that your blood sugar goes down. Maybe you'll see that when you eat a certain food, it really spikes more than you thought. And maybe next time you'll eat a little less of that food. You'll still eat it, but you'll eat a little bit less. So like Schaefer said, we put people on these devices with type 2 and their A1Cs drop 1, 2, sometimes more percentage points without any additional medication. So those of you out there, like Schaefer was talking about, that don't want to be on more medications, this device can improve your A1C without adding additional meds.
And you don't have to poke your finger. I mean, that's
huge.
sort of a simple but important thing about
carrot,
it is like you don't have to poke your finger, put this device on, you can check your blood sugar. And that alone, sometimes people are like, oh, okay. And once they start using it, they're like, wow, this really opened up my world to what's going on.
We hate pricks.
Is that your tip?
Yeah.
Okay.
You know what, Schaefer and Tricia, I don't think could have said it any better. It really is going to be the standard of care for type 2 for so many reasons. And our insurance companies are always far behind, as usual, only to people on 3 injections a day. And there are ways you can get a free trial with some of these companies. And I do think they're going to be less expensive, more accessible. And as soon as the rest of the world catches up with us, they're going to realize that it's going to save money, not add to the burden of paying for people's diabetes supplies.
And there are some insurance companies now that are covering for type 2s who are not on insulin. So go out there and check. There are a few. Yeah. It's starting.
That's good. That's good news.
Yeah.
So let's kind of finish up with our last big category, which is broadly we call diabetes burnout. And this really is important because this is such a huge part of diabetes is that, how do you engage with it? How do you stay on your medications? What kind of benchmarks for success do you set? Because it's so common. We all see patients that have probably been told for years, again, if not decades, you need to lose weight, you need to get your blood sugars down, or else, you're going to go blind, like all these kind of things. And it's very easy to feel defeated, nothing I do matters, all that kind of stuff. So Trish, let's start with you this time. How do you address this? Do you do it proactively? Do patients ask you things? Do you have time to cover this in visits? Walk us through that.
Yeah, I think this is a really hard one. And I would say, it's really important for people with type 2 diabetes to kind of look at what else is going on in their life. Because I often find when my patients come in and they're either not checking their blood sugars or their blood sugars are in the, 300s or 400s and they're feeling really out of control, it often has not a lot to do with their diabetes. It's usually something else is going on in their life, something stressful. There's financial stressors, there's relationship stressors. And I think, diabetes is such a hard disease. It's every day, it's all day. And when you have that on you and other stressors in your life, the last thing you can do is control your blood sugars. And then people tend to eat worse when they're more stressed out. They tend to, not check their blood sugars, maybe not take their medications. So I do think that kind of stepping outside of diabetes and looking at what else is going on is really helpful. And then the second quick tip, which I did say in our type 1 tip, is I tell people to just give yourself a break because it's hard. And managing this disease is hard. And we don't need to add to that stress, stress about how you're doing with your diabetes. So, this is a marathon, not a sprint. And adding that stress is not going to be helpful.
How often do you say your husband, Joe, take a break?
Oh, I never say that to him.
Right,
I just grind him.
I was just checking.
Well, and the other thing that I've heard you say too, Trish, is to kind of celebrate success, and by meaning kind of reframing what success is. So I think a lot of times patients will come in, their A1C is 12, 13, whatever, and they're just kicking themselves that they're not at 7. But reminding people that every kind of little step of improvement matters a lot. For every 1% reduction in A1C we get, it's something like a 30% reduction in microvascular damage. So going from 13 to 12 is a big deal, even though you're not there at 7. Yeah, there's still work to be done, but that's still celebrating that kind of momentum. And I don't know.
For sure. Yeah. And I think I have patients that will come and see me and they don't bring their, back in the day it was blood sugar logs or bring their meter or now bring their CGM for download. But sometimes I celebrate just when people are checking their blood sugars. That's a celebration to me because if I see blood sugars that are in the 300s, then I can do something about that. Whereas if I can't see it, I can't do anything about it. So totally agree. And we have to celebrate those smaller successes.
Schaefer?
Yeah, I would just say that diabetes distress or just diabetes stress, if you want to call it, it's real. And it's not something that we talk about that much. We do sometimes here at T2ID, but I think out in the world, people don't talk about it a lot. yet it affects pretty much everybody with diabetes, and that's a big group of people. So it's important to realize that if you're feeling that way, if you're feeling stressed about diabetes, or if you're feeling burnout and just over it, like, you're not alone, and it's super common. And so, that's the first thing. Just realize it's common, and it's actually normal to feel that way. But then really the tip then is to kind of like think about what are you going to do about it? And I think we as providers in general probably are bad at asking about it and even realizing it sometimes that it's going on in our patients when we see them. Sometimes the visits are too short, or we don't ask the right questions. And so I think, unfortunately, the onus is a little bit on the patient to just speak up about it. Like, a lot of times I'll ask a patient, like, are you taking your medicines? And they'll say yes, because that's what I want to hear. But really, I'd rather them tell me, I haven't been taking my medicines because I've just been burnt out. I'm tired. I'm stressed. Something's going on in my life. And that would really help me as a provider, give better care. And I could be like, okay, let's take this. Let's actually talk about what's really going on. And I think that's good for both of us. So as someone living with diabetes, it's okay to speak up about that and say, hey, I'm burnt out. This diabetes thing has just been rough, or whatever's going on. Maybe it's non-diabetes related, but it's weighing you down. So that's one thing, to bring it up to your provider, but also to find some community, whether it's, online or at TCYD, Facebook, or in real life with other people who are kind of going through it. I think it's really important to have someone that you can talk to who kind of gets it, who understands what you're going through with this disease, and just that it's kind of always there, and not necessarily to talk about your favorite medications or what your blood sugars are doing, but just to kind of like unload on and talk about some of this stuff that makes it a little hard, because it is a grind.
Yeah. Well said, Shaver. Well, Steve, anything you want to add to that? And like, what about, if nothing else, I mean, like, you talk about persistence and adherence of people staying on medications, which is wrapped up into this diabetes burnout, obviously big time. So maybe
I'll just add a couple of things. I think you said it really well, Schaefer. I mean, I have my tip after this little monologue is understanding. People with type 2 are generally older, as I said earlier. You're set in your ways, and type 2 is associated with the propensity to gain weight, especially in the abdominal area, which is almost impossible to lose. And then you have the associated high blood pressure, cholesterol, and diabetes, and all the other medical problems. And so, with someone with type 2, it's what we call a polypharmacy condition. Tons of meds. You think you're really sick. They cost a lot of money. And guess what? You don't feel that different if you skip your meds. So this whole issue, Jeremy, that you brought up is adherence and persistence is staying on the medications that you're prescribed. It's tough. And I think, knowledge is power. And I think my tip was going to be, you stole my thunder, was, join a Facebook group. We have one at TCYD for type 2. Find people that can support you and understand what you're going through. But it's so easy to say, screw it. I don't want to take these meds. I don't feel any different. And so you need someone, a good healthcare professional, to explain why you need these things. And healthcare professionals, quite frankly, they don't have much time these days. So you got to look elsewhere to get some support. And TCYD could be a good place. I'll give you Bill Polonsky's cell phone. You can look it up and tell you what it is. He's awesome. He understands that. And his website is really good. And he talks a lot about diabetes distress.
Yeah, and I think kind of like rounding it out is that changing our framework again about these new medications and treatments, that it really is an opportunity. And we've had patients that have, lost weight and really changed their lives. And like, we had a patient that came in and had to buy a whole new wardrobe of clothes, for stuff that would fit them, and was thrilled about it. So I think that is changing now with some of these medications. It used to be very much like, oh, these medicines just make me go low or whatever. Now it's these medications are making me healthy, making me lose weight, things that I've been trying to do for years, I finally can. So it really is a kind of exciting time for type 2. And so I guess my closing tip would be, engage with your provider, take advantage of these medications. And even if your A1C's been 14 for the last 10 years, it's never too late to engage and take control of your diabetes. So,
and I'll just mention this one quote by Sir William Osler.
Okay.
And I learned this through Bill. He said, the way to live a long and healthy life is to get a chronic disease and then take care of it.
Yeah. I like that.
It's so true.
You could claim that quote if you wanted. You could.
I almost did.
Yeah.
I felt kind of guilty.
Yeah. So Trish, closing thought, comment on anything that we've talked about?
No, I think, an exciting time in type 2 diabetes, I guess I would say. This diabetes distress is a real issue, but there's never been more things to look forward to that's making people's lives easier and making them live longer and healthier. So I'm excited to be involved.
My closing tip would be, if you listen to this whole talk or this whole podcast, like take a minute after it's over and just think about what you kind of took away from it, and then choose one actionable item and do it. Whether it's thinking about weight loss or finding someone to talk to about diabetes distress or whatever it is, whatever hit home for you, like choose one thing and then act on it.
Yeah. Well, thank you everybody for listening, and thank you for everybody for being here. Trish, Schaefer, Steve, obviously. We really enjoyed this. This is, I don't know, we've only done a handful of these podcasts, but we're really enjoying this and look forward to keep doing this. So thanks to everybody for listening. Check out our website, tcoad.org. Of course, we have the video vault there of a lot of lectures that we, have posted completely for free on all these topics, new medications, exercise, everything that we've covered. We have a video online that you can watch about it in detail. So again, thanks for listening and have a great day.